Hey guys, welcome to another video. So today I'm in Dental Boutique with Justina, who's an oral hygienist, and we'll be talking about oral hygiene, how to properly take care of your not only teeth but the whole body. Really.
Yes.
So we're going to go through steps. She's going to explain what's important and how to properly clean your mouth. Yeah.
And look after your mouth. So very often when I think about oral hygiene, we think about brushing our teeth.
Only.
I would start with dental visits, and that's because the dentist or a hygienist look inside our mouth.
And how often?
About every 6 months. Reason for that is not only that you might get decay or gum disease, we see a lot of mouth cancer cases. They are really on rise right now. I think the world that we live in now, we get very stressed. We often have got poor diet, smoking, drinking. These are all risk factors for mouth cancer.
And I think mouth cancer is something that we don't really talk about. This is the type of cancer that people don't really hear about. You hear about breast cancer, I don't know, lung cancer, but not really the mouth cancer. I don't really read or hear about it.
It's a very nasty type of cancer, difficult to treat if it is in advanced stages. If you go to the dentist and they see something suspicious, most of the time it's actually nothing. But if it is cancer, it can be cured very successfully at a very early stage. So looking after your oral health, first step is keeping your regular dental appointments. For that reason, you cannot really check your mouth yourself. You need someone to look in your mouth. Second step, we are moving to cleaning our teeth. By cleaning our teeth, we think about dental decay and preventing gum disease. For dental decay to occur, we need to have bacteria on our teeth. And those bacteria are removed by flossing and toothbrushing. The bacteria eat sugars, so we know sugar causes decay in our teeth, but it's not actually sugar, it's the bacteria that eat sugar. They produce acids, and acids damage enamel in our teeth. Then the bacteria leak through the enamel inside the tooth, and then they decay the tooth. So those two factors are really important in keeping our oral health, keeping on top of it. It is just removing bacteria regularly from our teeth and limiting sugars. It's not about the amount of sugar you eat in one go, it's about how frequently you have it.
Okay, so brushing teeth?
Brushing and flossing.
Flossing, these are...
Yeah, I know everyone who comes to and sits on my chair says, I hate flossing.
Including me.
And I understand it. It's not easy. Once you get slick at it, it takes 30 seconds. It is important because toothbrush doesn't get between the teeth and the gums. And the bacteria like sitting in that little pocket between the tooth and the gum, and they start growing there. When they grow, they attract different bacteria, and then it's called dental plaque. Dental plaque is a very well organized layer of bacteria, and you cannot treat it with antibiotics or mouthwashes. You actually have to disrupt it manually by flossing. You need to get floss underneath the gums and clean it.
So I thought personally that flossing is to remove the bits of food that just get stuck somewhere in there, but it's actually not really for that reason, not only because you can obviously...
Of course, you clean the food as well, so that way you eliminate the sugar load on your teeth as well, but it's actually about removing bacteria.
That's very interesting.
Yes, you just want to disrupt them. They are very well organized, they communicate between each other, they release some enzymes, and if you destroy that plaque, they cannot communicate anymore, and they are not as damaging to our teeth, and especially gums. Okay,
so what other reasons? How about the brushes? Is it interdental brush?
Interdental brushes, yes. It is an alternative to flossing. So if you find flossing is difficult, you can use the brushes. You need to think about them like gum massages. So they need to fill the whole gap between the teeth. Either flossing or little brushes are fine, as long as you're using something once a day.
Yeah. Mouthwashes?
So mouthwashes, this is a different topic. Mouthwash doesn't clean the teeth. So if it was going to clean in between the teeth, it would clean the whole surface of our teeth. We wouldn't need to brush our teeth. It just doesn't clean. It's an adjunct. There are two types of mouthwashes. We all know about chlorhexidine for anti-inflammatory action, but fluoride helps to strengthen our enamel. This is extra. You don't know.
This is an extra, so not everyone needs that step.
That's right. Not everyone needs that step. I treat it more cosmetically. If you want to refresh your breath during the day, you can use it. But there are some people that do need it, and it's usually people who have a lot of fillings in their mouth, or who cannot keep their teeth very clean for numerous reasons. They may find it difficult to use a toothbrush. They may have manual dexterity problems. Children. And how it works, we talked about those bacteria who release acids, and the acids damage our enamel. Enamel loses mineral, and then we use fluoride mouthwash. That mineral is replaced with fluoride, and it is stronger. So enamel gets stronger if you use fluoride mouthwash.
Quick question. So how many times do we brush our teeth a day?
Twice a day.
Twice a day.
Really important, because you disrupt those bacteria. Brushing before night time is the most important time during the day. But you can brush 5 times a day. If it is just a quick 10-second brush, it's not going to work. So good 3 to 4 minutes. For kids, I would say 2 minutes. But grown-ups, we usually have got difficult teeth. We may have crowns, fillings, a bit of crowding, and we just need to spend a little bit longer cleaning our teeth.
Flossing, how many times a day?
Once a day.
Once a day.
And it doesn't matter when you do it. You can do it lunchtime. You don't have to brush your teeth.
Oh, so it don't, okay.
As long as you do it once a day, get rid of plaque, fine.
Now my question is about oil pulling, because I've been practicing this for years, and I've really find it really helps me get my teeth like proper clean. I feel like I feel really good after doing this. I've been practicing it for years, so I really believe in it. What do you think about it?
Yeah, oil pulling, it's an adjunct. So we won't replace good brushing, it won't replace flossing. But once you've brushed and flossed your teeth very well, so you've got nice clean surface, coconut oil is antibacterial, so it really helps to reduce bacterial load on our teeth and in our gums. There is not enough research, clinical and scientific research yet. But from my own experience, I've noticed a lot of my patients who do oil pulling, they've got really nice shiny teeth and really strong gums. So they do floss, they do brush really well, and that oil pulling really helps to, this is the last step.
Just the extra little bit that helps keep your mouth.
But if you have time to do it, I would recommend it, because I've seen great results.
That's perfect, fantastic. Anything else we need to know? I think we wanted to talk about how actually looking after your mouth has got an effect, positive effect on your whole body. And
that's right. There is more and more research about how our oral health affects the whole body and our general health. This is because when we've got gum inflammation, our gums are open. We've got blood vessels that communicate with our mouth, and we have those bad bacteria sitting right next to the gum. They go through blood vessels into our system because the blood vessels are open. So they will get to our lungs, they will get to our heart. If you're pregnant, they will get to your baby, and they are very nasty, those bacteria. So this is why we don't want any bleeding in your mouth. Healthy gums don't bleed. So if you get bleeding, it's your body saying, clean me more here. This
is amazing, because how everything, it's amazing how everything is connected, and our body will think, you think you're looking after just one thing, but actually it's the whole body. And that's right. That's really amazing, and it's really it shows how important just this little step of looking after your mouth is important.
I'm passionate about holistic approach, so this is why I always say to my patients, it's not just about your teeth, it's about your whole well-being. If your mouth is healthy, you really increase the chance of your body being healthy too.
Okay, so thank you so much for this.
Thank you.
Justina's really passionate. I love this place here because they're like, you know the difference when someone's passionate about what they're doing. So please tell us where you're located, where people can find you, and what you offer here.
If you would like to ask more questions about anything about teeth, gums, mouthwashes, any advice that you might need, send us an email, ring me, or comment below. Our clinic is located in Fulham, very convenient location, and what we do here is mainly prevention. We are really big on prevention, so you will always get tailored advice about how to look after your teeth. We do advanced cleans and polishes here, and we've got specialists here. So if you need treatment, not prevention, we do that as well. So we provide implants and cosmetic dentistry as well.
Perfect. Thank you so much again.
Thank you, Magda.
Thank you guys. If you have any questions, comment below. Thank you so much for watching, and I'll see you next time. Bye bye.
Bye bye.